The knee is a complex joint which is composed of bones, cartilage, tendons, and ligaments. In the knee, the ends of two bones, the femur on top and the tibia below, are covered by a smooth, firm coating called cartilage. The back of the patella, or kneecap, is also covered with this smooth cartilage. Cartilage allows the knee and the kneecap to move smoothly. Healthy cartilage enables you to bend your knee easily and without pain. Arthritis occurs when cartilage wears away and the joint can no longer move smoothly and without pain. The most common form of arthritis is osteoarthritis. In osteoarthritis, the cartilage degenerates due to age and wear and tear, and may be related to family history. Inflammatory diseases, such as rheumatoid arthritis, also cause loss of cartilage. Trauma, such as repeat sprains and fractures, may damage the cartilage and cause early arthritis. Patients with knee arthritis often experience pain with activities such as walking, stair climbing, and rising from a seated position. These patients also often have stiffness and reduced motion in the knee. The knee may become swollen and warm with inflammation. When cartilage wears away, it may cause a grinding sensation in the knee. When cartilage is completely worn away, one bone may rub against another and cause increased pain. Although cartilage cannot be seen on X-ray, you can see how wearing down of cartilage affects the space between the bones. In the first X-ray, note the wide, smooth space between the two bones. The space reflects healthy articular cartilage, maintaining a normal joint space. In the second X-ray, the cartilage is worn away, and the bones are touching. This is the bone-on-bone condition that occurs when cartilage is completely worn away.